welcome to Healthy Living. May is Women's Health Month. So today on Healthy Living, we're going to be talking to some of our colleagues from the Women's Pavilion and also from the New Family Center. So right now, we have with us Joy McWilliams. Joy, thank you so much for joining us. Joy is our breast imaging supervisor at the St. Tammany Health System Women's Pavilion.
Yes.
So tell us a little bit first about what you do at the Women's Pavilion.
Yes. So yes, I am the breast imaging supervisor at the Women's Pavilion. In addition to providing patient care, which includes performing the mammograms and breast procedures, I also just oversee the staff and the smooth operation that we offer.
So where are we located, the Women's Pavilion? For people who might not know,
Yes.
It's very centrally located in West St. Tammany. Can you tell us where?
We are off of Highway 190. If I can say a landmark, we are behind IHOP in the movie
Sure.
tavern in the back. The address is 301 North Highway 190, Suite C2.
So you kind of just go back there and you'll see it. It's kind of laid back there. It is a beautiful, beautiful space.
Yes.
It's a spa-like atmosphere.
Correct.
It caters to women's health needs. So let's just talk about some of the things that we offer there. What are some of the services that a woman can come there and receive from the Women's Pavilion?
Yes, we offer screening and diagnostic mammography, breast ultrasound, MRI, breast interventional procedures, and bone density test.
So if someone needs one of those tests, should they ask their doctor to refer them? Can they say if they're just due for their yearly mammogram, can they just call you up and make an appointment? What is the procedure?
So we can accommodate most studies same-day appointment, and screening mammograms do not need a doctor's referral.
Okay.
So yes, they can be self-referral, and we also offer Saturday morning appointments for screening mammograms.
Oh, that's nice.
Yes.
That's good to know.
Yes.
So someone would just call the center? Okay.
Yes,
All right,
ma'am.
great. So let's talk about a couple of things that are going on, a couple of new things that are going on. We're a breast imaging center of excellence through the American College of Radiology. So what does that mean? What does that mean to the average
Yes.
woman or husband of the woman who is kind of looking for
Right.
that service?
So the American College of Radiology will recognize a facility as a breast imaging center of excellence when they earn accreditation through their imaging services that they provide. So that entails every 3 years undergoing thorough evaluation of our imaging equipment, image quality, and the staffing qualifications that need to be met per the ACR standards.
Okay, so it is a very elaborate process. It's in-depth. So how secure does that make people feel when they come there knowing
Yes,
this?
so that makes our patients feel the comfort and confidence that they're getting, knowing that they're getting the best quality care in their breast health.
Yeah, so we recently got a very, very, very special leading edge piece of equipment. It's our stereotactic breast biopsy table.
Yes.
Now, tell me about, before we had the table, let's talk about some of the things that piece of equipment has improved upon when it comes to a woman having to have a breast biopsy, or a man for that matter, because we know that that can be a very stressful time for someone knowing that they might have something that is suspicious and they need to get it looked at.
Right.
So you have that anxiety that's already built in.
Right.
So what is so different about this table from the way we were doing it, say, before?
So our new table offers our 3D tomo images that the old table did not, which is, it gives more of a precise image for the radiologists and precise targeting for them as well. Also, we have another piece of equipment that goes with our table where when the radiologist is taking a sample of the breast tissue, prior to the new machine that we have, it would take a little bit of time to have to image that specimen. The new machine that we have, once the radiologist takes those samples, it's automatically taking images of that sample, so it's definitely a lot quicker procedure. The table definitely has a little bit more comfort than the old table. It's also, the new table has access to the breast tissue 360 degrees, so we can access the breast tissue better than the old table as well.
So you've upped a level of comfort. You've condensed the amount of time that it takes for someone to have the procedure done to them.
Correct.
So what have you noticed from your experience? What have you noticed from the patients from their side? How has it improved their
anxiety
experience?
is definitely lower. and we just have a staff that's very personal with our patients, so we just give them the best comfort that we can.
And is there any kind of special training that had to happen for the folks who use this machine?
Yes, I mean, all of our techs are mammo registered, and we are trained to do the procedures, yes.
So this is a wonderful tool.
Yes.
Now, for people who possibly can't lay in a prone position, you definitely have other options, correct?
Yes, we also have our mammo unit in one of our other rooms where patients can sit in a chair, and it's the same procedure, but just the patient is sitting. So we have everything that we need for patients' comfort and capability.
Okay, so let's just talk about kind of the overall women's pavilion atmosphere, because when you walk in there, like we talked about earlier, it is a very, very calming spa-like setting.
Yes.
And what would you say to women who have anxiety about breast health care and what they can expect when they come through those doors, from the atmosphere to the staff?
Yes, they can expect our staff to be very professional and very personal, just giving them that comfort of knowing that we are there for them. And we are with our patients every step through their breast health journey, from screening to diagnostic to diagnosis. So it's just very important for women to know that early detection saves lives. It's important to have screening mammograms every year.
Yeah, so come on in and we will take good care of you.
Yes.
And we have a very well-rounded staff, multidisciplinary team who is there to work with you and your doctors and everyone involved to make this happen. So where would someone call? Can you give us the number? Let's see, I think we wrote the number down here.
They can call 985-871-5665
to make an appointment.
Yes, ma'am.
And you can also learn more about our Women's Pavilion at sttammany.health/breastcare. So we appreciate you so much coming, Joy. Thank you so much for talking about the Women's Pavilion. We are going to talk a little bit more about the Women's Pavilion coming up in our next segment, so stay tuned to meet Kira Smith. She is our nurse practitioner at the High Risk Breast Clinic, right next to the Women's Pavilion. So we'll be right back.
Hi, I'm Joy McWilliams, the breast imaging supervisor with St. Tammany Health System Women's Pavilion. We are looking at the new Hologic prone stereotactic breast biopsy table. The table where the patient lays down on their stomach, it's definitely more comfortable than what we had prior, and the accuracy of the targeting for the doctor is more precise. This is our new Brevera machine, where when the radiologist takes a sample of the patient's breast tissue, it automatically takes a picture while they're taking the sample. So it's definitely a much quicker procedure than what we had before. So depending on the case for the patient, we can target and access the breast tissue from any angle, unlike our old table. So it definitely is a quicker approach, a more precise approach for the patient. I would like to take this opportunity to reiterate the importance of early detection. At any of our facilities, patients can have a screening mammogram without a doctor's order. They can be self-referral, and they can give us a call at 985-871-5665.
Here at St. Tammany Health System, we're empowering our mothers, our sisters, and our daughters like never before. Throughout our entire system, we've invested in the highest level of technology available to provide more accurate diagnostics, less invasive care, and faster recoveries. Together with our partner Ochsner Health, we're giving women many ways to live stronger and better.
Welcome back to Healthy Living. We were just talking with Joy McWilliams from the Women's Pavilion, and now we're here with Kira Smith. Kira is a nurse practitioner at our High Risk Breast Clinic, which is right next door to the Women's Pavilion. You literally walk through a door to go through there. So thank you so much for taking time today with us.
Of course. I'm happy to be here.
We're happy to have you. So, May is Women's Health Month. We want to highlight the things that we have to offer for women at St. Tammany Health System. So let's talk about you a little bit. Tell us a little bit about yourself.
Sure. I'm Kira Smith. I'm a family nurse practitioner. I work at the High Risk Breast Clinic for St. Tammany Parish Hospital. I grew up in St. Tammany Parish. I've been nursing for about 25 years, providing quality care to our community is definitely a passion of mine.
Good. So that's nice. You're in your own community. You probably see lots of people that you know and you can help. That's great.
Yes.
So what is your role at the High Risk Breast Clinic?
So the High Risk Breast Clinic, we offer women who are at increased risk for breast cancer the opportunity to be proactive and take control over their breast health. When you come in, we have a very in-depth visit. We review family history, personal history. We will discuss and evaluate genetic risks. We will also go over high-risk screening recommendations and talk about ways to reduce risk. So by the end of the appointment, you have an individualized plan and you understand what the next steps are moving forward.
Yeah, so we kind of covered why someone might come. How do they get there? How does someone get there?
Great question. So you can self-refer, and who would come to the high-risk breast clinic? These are patients who are at increased risk for breast cancer. It'd be patients that have a family history of breast or ovarian cancer,
Right.
A family history of a genetic mutation like BRCA1, BRCA2 that can increase risk for breast cancer. If they've had an abnormal result on a breast biopsy, and also if they have increased breast density or an increased Tyrer-Cuzick score. Those two things can be found on your mammogram report.
I gotcha.
So a Tyrer-Cuzick score of 20% or higher puts you into that high-risk category.
Okay.
So if you recognize that you fit into any of this criteria, we would love to see you. You can self-refer, you can call, you can walk over. We're right next door to the Women's Pavilion.
Right.
You could also ask your gynecologist or your primary care to refer over to us. So it's pretty easy for us to, get you in, get an appointment, and meet with you.
So what would you say makes our facility so special? Because it really is. It's a lovely facility. It's very warm, welcoming, calming. So what would you say makes it that way?
I agree. I feel like I work with an excellent group. Everybody's very caring and compassionate. They go above and beyond for every patient that comes through the door. And I think that patients really appreciate that. And I think that's something special about St. Tammany that we offer.
And we talk about that we have a multidisciplinary team. So for the person who might not know, why does that even matter? What is so important about that team, and what do they do? How do they kind of shore up the care?
It's amazing, the group that we have. Multidisciplinary for me, we are located right next door to the Women's Pavilion. It allows us to communicate in real time. And for example, if the radiologist found something that was concerning, they could pick up the phone, call us. We're right next door. Patients could walk over. We could get that appointment, immediately planned.
And then you have that gift of consultation as you go through the process.
Exactly. And I think patients really appreciate that.
So we know that you take patients through many steps of the process, from identifying, if they are high risk, if there's a problem, what to do next. And then we also offer survivorship care. What is that? What does that mean? What is that?
Great question. So with better cancer care, patients are living longer. A patient is considered a survivor from the moment they're diagnosed, during their treatments, and throughout the balance of their life. Survivor refers to, having that cancer diagnosis, and sometimes you have special needs going through those treatments. For example, you may have pain, fatigue, mental distress. Our breast cancer patients sometimes are at risk for lymphedema. So identifying these needs and getting them connected with the proper intervention to help them, get back on track and overall, the goal is healthier outcomes.
Yes, and that's part of that multidisciplinary approach, because you can connect them with the people who can help them through it.
Exactly. We can connect patients with services like yoga, Tai Chi. There's acupuncture, which is effective for pain. We can connect with physical therapy, dietitians. There's a lot that we can connect our patients with.
Yeah, so
as
it's
far
more
as
than
resources.
just testing and diagnostic. It's the whole person's care.
Right.
So what else would you like to add just about the Women's Pavilion, the High Risk Breast Clinic, what you do, and how fulfilling it is for you. Anything like that?
Sure. I'm love it. I think we're a great group. If you feel like you're in that high risk category, we definitely want to see you. We're located right next door to that women's pavilion, like Joy described earlier. Yeah, it's a red brick building. If you need landmarks, it's behind the IHOP and the movie tower. But it's a great atmosphere. It's an incredible group, and we would love to help take care of you.
Okay. Well, thank you so much for joining us today. We appreciate you coming in to talk with us about Women's Health Month and about what we offer at the Women's Pavilion and the High Risk Breast Clinic. So thank you so much. We are going to be right back. We're going to talk with Jamie Romage next. She's from our New Family Center. So please stay tuned.
Kids should be seen and heard.
At St. Tammany Health System,
Many kids are being treated like, well, kids. We're not little adults, you know.
they have the North Shore's first kids-only ER.
And ICU. They even have a parenting center.
Kids aren't the only ones who need to go to school.
Together with their partner, Oxnard Health, St. Tammany Health System makes it easy to be on our side. On this side of the lake.
Welcome back to Healthy Living. We are back to talk about more about Women's Health Month. And joining me now is Jamie Romage. She is the Director of Lactation Education for our Mother and Baby and New Family Center. So welcome, and thank you so much for coming with us today, for spending time. So tell us a little bit about what you do, first of all, before we even start talking about the New Family Center.
Okay, so I'm the director. Cindy Ingram is my AVP. I work under her. I'm, as you said, over lactation, mother, baby, and New Family Center. So we know what lactation is.
Right.
Mother baby is where you go after you deliver your baby, and New Family Center is where you go to have your baby.
Okay, and this is located within St. Tammany Parish Hospital, so it's within the hospital. Tell us a little bit about what it encompasses, because a lot of women, they have an expectation in their mind. What do I expect when I'm going to have a new baby? They think about labor and delivery, and that's it. You go in, you have the baby, you go home. But the New Family Center is very holistic in a lot of ways as far as the care of the mother and the new baby. So can you tell us a little bit about what the New Family Center offers, an overview?
Yes, and I'll give a little bit of background.
Sure.
The New Family Center unit was originally built to be LDRPs, which if you've had a baby, that means you labor in the room, you could deliver in the room, and then after you have the baby, you would stay there. But our parish has grown so much that we no longer can fit everyone in those rooms. So on the New Family Center, you will labor to have your baby, and in most cases, after you deliver, you will go to another unit, which is called Mother Baby. It's also called couplet care, and that is where you will stay until you go home. So we have a 19-bed unit, and we have 2 operating rooms on the unit. At the current time, we have a triage area, which is where you might go if you think you're in labor or if you're having a problem related to your labor, and that's for people who are 20 weeks pregnant and farther. However, we're building a brand new, it's going to be called an OBED.
Okay.
So it's basically an emergency room where we will have 24/7 coverage for all of our patients, that for the same thing, if you come in with a problem, you would be cared for, but now we have providers there, board certified obstetricians, who will care for you if you come in.
Well, that's great to know, especially because it is, pregnancy is really nice. It's really fun. It can be exciting, an exciting time, and things can happen though.
Yes.
So you want to have that assurance that you have somewhere to go. So you're saying instead of going straight to the emergency room, you would go to the New Family Center.
Correct.
And you would be triaged there for your care.
Correct. And if something comes up that you would have to deliver emergently, we have our community providers, but if something would happen in the situation where we're waiting for them to get to the hospital, we do have the OB hospitalists that could be there, that are there, that can care for you if needed.
So let's talk about that right now a little bit. Currently, we do have hospitalists on staff 24/7.
We do.
And you are offered that care. It's just not kind of under the umbrella of the OB/ED right now.
Correct. The hospitalist program is new to St. Tammany. We started with it in September. And it's just very exciting to have those doctors because we have wonderful community providers. They're really great, but they don't have to be at the hospital 24 hours a day, 7 days a week. So if you're a mom in labor and something went wrong prior to September, the community physicians get there as fast as they can, but there may be a time until they get there that you sit and wait. So it's been very exciting to have the OB hospitalists at the hospital because if something emergent does come up, they're there. You could be traveling down the road, maybe not even from Louisiana, and have something come up and you may need to be checked out, and they're there waiting for you. So it's been a great program, so we're very excited.
And we also have the supportive nursing staff as well. Can you talk about that a little bit?
I can. I think we have the best of the best. We take pride in hiring the best nurses. There's been a nursing shortage, which has put a lot of difficulties on us, and so we do everything in our power to make sure that we hire the best nurses. If they're not trained, we have a great program where we train them ourselves. We give them one-on-one with a nurse to teach them how to build their skill level to be the greatest, and we're very proud of that. We have a great unit. A great staff, and I think they do a great job.
And we definitely want to make new mothers and families feel welcome and cared for and safe. So it's very significant. So when an expectant mother, when a woman is expecting a baby, is there a time when she can kind of come into the new family center and get a visit or kind of walk through it?
At the moment, no, but we do hope that changes soon. So when COVID came along, we shut down all visitation. So we made a video. It's on the St. Tammany website that you can go watch. We probably need to update it because things have changed a little bit.
Right.
However, we do hope to open visitation back up again and start having classes, but we're undergoing renovation for that OB/ED that we talked about. So once that's open and our waiting room is back to its full size, then we will start having our visitation where people can come and see the unit again.
And the OB/ED is coming very soon, within the next couple of months.
Yes, most definitely.
So, but mothers can come now. If you have a problem today, you can go up there. If it's 3 in the morning, someone will be there to care for you.
Yes.
As an expectant mother.
Yes, and be seen by a board-certified obstetrician. Yes.
Okay. So what advice would you give expectant mothers as far as just for the whole experience? Like what should they kind of prepare for?
Learn everything you can. Read books, go to whatever classes you can. We do offer classes through our parenting center and through the hospital. You can go to St. Tammany's website and take any classes. Learn everything that you can and keep an open mind because everybody thinks that everything goes like clockwork and it's going to be the same. Your friend had a baby and it's going to be just like that, and it's not always. It's very different for each person. So keep an open mind and know that what happened to one person, you could have a different experience.
Yeah, everybody's experience is unique.
Yes, very much.
Well, is there anything else you would like to add about the new family center, about St. Tammany Health System, about the hospital?
I've been at the hospital for 23 years. I love it. I hope to never go anywhere else. I've been living in Covington for a long time. St. Tammany feels like home to me. We have a level 3 NICU also to take care of babies that may need a little bit of help. That, you know, those situations that we talked about, that things didn't happen just as planned, to take care of those babies. And we have coverage there. We have board-certified neonatologists and neonatal nurse practitioners there also to take care of the babies.
That is very comforting and very special to us, obviously. We also have a pediatric emergency room.
We do.
So once the baby is born and you get home, any worries, we've got you there covered there too.
Yes, and along with our pediatric unit, we also have a pediatric ICU. So we're doing everything that we can to give, you know, families the care that they need at St. Tammany.
Okay, well, thank you so much, Jamie, for joining us. I really enjoyed our conversation.
Thank you.
And that was a lot of good information for our expectant mothers and new families. So thank you so much for joining us for this edition of Healthy Living. We will see you next time.